I did put my introduction at the very end of the slide deck. But my name is Shauna Merrick, and I am from I'm an enrolled member of the Omaha Nation and the Nkesa Bay Clan. I'm a social worker, really by trade, MSW, LSW, CDCA, but I am located here in Cincinnati, Ohio. I do have strong ties to my tribe, to my family. And so I'm really excited to have had this opportunity. This is probably, it's always the best of all worlds when I can present on things that are personally and professionally passionate to me. So I'm going to dive right in, and then please, we'll have questions if there are any at the end. So I was just trying to give the learning objectives that just sort of a basic overview, so some basic understanding around American Indian, Alaska Native tribes, the scope of substance use disorder within American Indian, Alaska Native tribes, and then specific Native American deflection programs. So the Native American population, there are 574 federally recognized tribes. 347 of those are located in the 48 states below Alaska, and 227 are located in Alaska. Because this isn't I know it's not a specific Ohio echo, but I'm from Ohio and also being Native, that I wanted to bring in some kind of local data as well. And so in Ohio, there are, according to the US Census data from 2023, there are over 35,000 Native people that are living in the Ohio area. There was another document that had ranked like the population size of Native people within like Franklin County and Cuyahoga and Hamilton. And I raise this only because there are no reservations in Ohio. But that's just about history, that there were certainly Native people in Ohio historically. And there are still Native people in Ohio. Cleveland is a notorious relocation. There was once in the 60s a relocation program for Native tribes, Native tribe people. And so Cleveland has a very high population, Franklin County. So just to bring awareness to that and just kind of capitalizing on that there are Native centers in Ohio. And so one is in Columbus, one is in Cuyahoga, and one is here in Cincinnati. At one time, I recently attended an event. I'm a member of the Urban Native Collective here in Cincinnati, and there was an event in Columbus. And at one time, Ohio actually had somewhere between 11 and 12 Native American centers throughout Ohio, and it is now 3. So there's been this kind of resurgence for Native people to be able to find spaces where they can connect. And so like in the Urban Native Collective, I participate in like a beading circle and a book club and just community events to gather. So I just say all this to give some foundation, just so that people have some awareness around Indigenous people and Indigenous people that may be around us. We talk about substance use disorder among American Indian and Alaska Native people. What we find in research, statistics, this survey, that there is a disproportionate when you compare it to kind of other populations, that 10% of Native Americans have a substance use disorder, that 4% have an illicit drug use disorder, so like opiate use disorder, meth tends to have a strong hold on tribal lands. 7% of Native Americans have an alcohol use disorder. 25% report binge drinking in the past month. So I'm just going to share that I know from my family that has been substance use disorder has been a very, I've been personally affected by that within my family, whether it's close relationship. So like even with my father and my uncles and aunts, it's my brothers, my sisters, that oftentimes where I come from in the Omaha reservation, there's kind of like three, it's a very bittersweet place for me. I mean, it's a place that has a lot of heart and a lot of love. But when it comes to substance use disorder, you can see how disproportionate it is. And that I found that oftentimes with my relatives, it's either people choose to, at some point in their life, choose a path of recovery, prison, or death. There's been a lot of young deaths that were directly related to alcohol or drug use. So it is a very prevalent issue among Indigenous communities. We looked at overdose rates for American Indian and Alaska Native people. Again, it's very disproportionate. So there was a 20% increase of overdose death rates from 2020 to 2021. When we look at the last one, this was the last bullet point. This is the one that really kind of got me, that in 2022, there was 65.2 drug deaths per 100,000. It was a rate that was twice as high as the national average of 32 per 100,000. So all of this to say that these are significant, destructive, and prevalent within tribal communities. One of the places I went to go look, say, okay, so now we know this, right? We know that there are these disproportionate, that this is prevalent substance use. Went to the Center of Indigenous Health, which is a subsidiary of Johns Hopkins. And one of the things that they created with other tribes across the nation is how can we put down some unified tribal principles when it comes to Indigenous health? What are some things that we agree upon that we would hope for as we're building programs, building collaborations within our tribes in order to, for the betterment of our tribal citizens? So one of the things so whenever I go into other tribal spaces, I mean, I'm always thinking about culture first. So what are the traditions? And this can be a really challenging space, even for me, because when we say 574 federally recognized tribes, what we're talking about is 574 sovereign nations. So it means that you could have very different language, traditions, customs within each one of those tribes. And so the culture first is really like putting ourselves in a position to be the learner, to listen, to ask questions. I mean, to build allyship so that we can support those cultural and traditional healing in those communities. Just to elaborate on that a little more, that's been really exciting within the Medicaid space because Medicaid has agreed to allow Medicaid reimbursements for traditional practices. So for things like sweat lodges or different ceremonies, even things as much as like making baby boards or cradle boards, I mean, that promote and around the health of infants and moms. So that's been an exciting move forward to invest in reciprocal learning and partnerships, healing support. That's, I think, really vital. And this is not just to Indigenous. I mean, I think that we can see this across other communities as well, but the healing support that's needed for families. So investing in parents and caregivers and elders, sustaining and enhancing substance use services for youth. That 18 to 25 range is a very vulnerable space for many, not just substance use, mental health and suicide rates. So, what can we do for youth? And then creating opportunities for holistic well-being. So just that inclusivity around culture and tradition could be food sovereignty. I mean, there are certain within different tribes that this would all come into play, thinking about all of those things. Now I'm just diving right into the two examples that I wanted to give. Now, I know that Dan has been here, the White Earth Nation, which is in Minnesota, and I had the opportunity. They also host annually a Native American Harm Reduction Summit in the summer. And so I was able to go to the White Earth Nation and hear and listen to their overdose response program. And I was just amazed. I mean, I have to tell you that their partnerships and collaborations with their public safety, their EMS, their behavioral health services. And I think that's where we see that, right? Within Deflection, all those different pathways, and the more opportunities that we can get across those pathways, the more success we can see in communities. What I would say that I noticed in White Earth Reservation, much like many other rural space, that's really challenging work, because when I was listening to their responders talk just around, I might show up, I get this report of overdose response and I show up and it might be my brother or my aunt. Or so to me, that really had a ring of difference that I don't feel here in Cincinnati, Ohio. So like when I was doing this work, it was not, I never once actually knocked on a door of someone that I had a personal relationship with. And so I think thinking about that and how they navigate those spaces. I mean, we need to do a lot of care for our first responders anyway, but I think in rural spaces, it can have kind of that extra, how do we manage through? They do a lot of naloxone distribution and training. And again, in partnership with all of their public safety officials, their overdose prevention education, their support for overdose survivors and their families, their collaborative work with local emergency services. The other part that is challenging for reservation spaces is also having access to kind of, as you see in the deflection programs, like, okay, so we provide the overdose response. So how can we ensure that you can make connection for recovery services? So whether that's peer support services or medication assisted treatment, inpatient, outpatient, and on many reservations, it's like rural spaces, it's not easy to access. So White Earth they've created this very strong and evolving collaborative work among many parts of their departments within their tribal services. If that makes sense. It's a very amazing. So if you get an opportunity to look them up, please do check them out. I really saw them as they are very much an example for other tribal communities in terms of how to build those relationships and collaborations and to do this work. Choctaw Nation Harm Reduction Program is also, even though it's called a harm reduction program, they are a deflection program. The very first thing they did was they started with their coordinated response. And the Choctaw Nation, this is in Wisconsin. I just wanted to, so White Earth is in Minnesota, and the Choctaw Nation is in Wisconsin. I think that's right. For them, the very first thing they did is they started with their coordinated response, which was working with first responders, law enforcement, public safety officials, and how we can do naloxone distribution. And when they first started doing this, they talk about how it was kind of like one person who was designated the program director, and she was literally just loading up her car full of naloxone and like driving to all the spaces within the reservation to hand out naloxone. And at first there was a little bit of that concern that if we put these safety up, but the more she got to engage with people face to face, and I'm talking about like law enforcement and EMS and other public safety, and then public safety started coming to her. That's kind of the story that happened for her. is that because residents started coming to their public safety officials asking if they knew anyone who had naloxone. So it really just helped build this organic relationship between um, public safety and public health officials. And so that's the other big part of how they have grown their program is using ODMAP, so the overdose mapping tool. And that really gave them the opportunity to create in those, like looking at those hotspots and how can we coordinate and collaborate services based on those hotspots so that we can further, best utilize our resources, getting out the message, but also knowing that they're going where people need the service. So starting where people are. Treatment access, they recognized was an issue. And so the Choctaw Nation worked very hard at ensuring that they had the full continuum of care available within their tribal community. That services were sometimes I included here because there are complexities to tribal health services because of it's more of a for many tribes it's a federal relationship and not to the state or local. The tribes again they function as sovereign nations in and of themselves. And I say this because it makes pharmacy management challenging. So getting the medication available and on the shelves, there's a different regulatory process that you go through. Um, and so that was something that they wanted to ensure that they could address so that they could have access to medication within their health clinics. And then again, healing through culture. They adopted Wellbriety, which is a movement that was made by tribal people that is based off of the kind of traditional 12-step program that's available through Alcoholics Anonymous, but they use that as a foundation to write to Wellbriety that would be more inclusive of traditional practices. So whether that was something like smudging or sweat lodges or talking circles, um, or drum circles, that it was more inclusive in that way for tribes. This was made by, her name is Annette Hubbard, and she is a harm reductionist out of Alaska. And I'm only sharing it with you just because when I first saw when I go home to the reservation, these are the things I feel. These are the things I see. And it's not to say it doesn't happen in other cultures. I thought it was just so beautiful to kind of see it in black and white. That these are a lot of the values that happen among Indigenous people. Happiness and laughing, sharing and gift giving is a giveaway. Those are big parts of the culture. Extended family before self. When I think about my Omaha, so within my Omaha family structure, first cousins are all considered brother and sister. And on the Omaha side of my family, I have 51 first cousins. Um, so I have a lot of brothers and sisters. There isn't really this use of the word cousin or great, that it's kind of like grandfather, grandmother, aunts, aunties, uncles, and brothers and sisters. So it just kind of tightens how family is viewed. Honoring of elders. So like any ceremony I've ever been to, just as an example, like elders will take time for reflection or prayer. You would ensure that elders are served first, like in any event that you would go to. A lot of learning through legends and stories. So I heard a lot of different types of stories from my relatives growing up, some of which were very beautiful and some were like kind of scary. Um, Learning, like looking to traditions, working for purpose for the common good, idea that time is only relative, that it's oriented to the land. Cherishing memories with youth. Uh, Living animals are considered like animals are considered like relatives. So like Omaha, I mean the Buffalo. I'm from the Buffalo clan, in case of Bay clan. And so and traditionally, if they were buffalo hunting, the tribe would truly use every part of the buffalo, and they would offer something in return to the land. Um, Cherishing language, that's been really hard, really challenging. Ensuring that we can maintain language for tribes and just that children are gifts. So, I mean, between children and elders, that like really upholding those spaces within community. These were the resources and references. These are all links. So I hope that you're able to click on them if you'd like to learn anything more or further. And I really, again, and I totally appreciate this opportunity to talk about something that I really do have a lot of heart around this work and around Indigenous populations. Thank you.
Thank you, Shana.